my first job was brutal. I think the first 18 months or so, I don't think any of the nurses, except maybe one or two, accepted that I was a nurse and I was going to continue working there.
Mr. Sandman, bring me a dream. Make him the cutest that I've ever seen. Please turn on your magic beam. Mr. Sandman, bring me a dream.
Probably the most ribbing I got was from friends, male friends especially. And the comments about, do you wear hose to work, and are you going shopping for the weekend, things like that. The one question that bothers me sometimes still that I get is, when did you decide to become a male nurse? And I say, when I didn't want to get a sex change. Because, the person that's asking you is already saying that this gender role is very defined, that you're a man, so obviously you must have accidentally fallen into nursing. There was some, not opposition to me being a nurse, but some inquisition, some curiosity from especially older family members who were in their 80s when I started in a nursing career, and they just couldn't understand. They couldn't understand why I didn't want to be a doctor. Why would I ever go into nursing?
Even before the profession of nursing was established, there was an informal division of labor within families in which women were typically the people who cared for, who nursed. So there is a long time cultural connection between nursing and certain perceptions of gender.
You don't have to be a doctor if you're a guy, I think that's like the stereotype. And it's funny because I have a 7-year-old sister, and the other day she's like, "You're a nurse? That's funny. I thought only girls are nurses." And I'm thinking to myself, wow, I go, she's like 20 years younger than me, and that still is the truth. Like, that's still like being talked about at schools, that kids still think that nurses should be females.
When a man becomes a nurse, in gender terms, he has still descended the gender ladder. Positions that are defined as masculine are more highly sought after, enjoy greater prestige. I mean, there's a lot of social approval attached to a girl doing boy things, as long as she doesn't go too far. Whereas the male equivalent of a tomboy is a sissy. And who wants to be a sissy?
I think it goes back to World War II. I think before World War II, if I know my history well enough, there were male nurses before World War II. A lot of them got sent away for the war, and there weren't as many to come back and be nurses anymore. And it just became a female profession by default. There were more women to do that work.
When the dizziness stopped, when the fog cleared, an army nurse was at your side. A woman who meant safety and comfort and home to thousands of men before you. A woman who meant all those things to you. Professionally skilled and capable, in her there is the tenderness of all women, of mother and sister and friend. Her voice and touch lend encouragement, instill hope.
But in our generation, I'm in my mid-30s, and when I grew up, I thought of a nurse as a woman too.
A lot of times, if they see a male nurse that comes into the room with a female nurse, patients or clients will refer to the male nurse as the doctor walking in with the nurse. So there's a lot of misconception that way.
Yeah, we get that question a lot from patients and family members and such. Are you the doctor here? It's good to see you, doctor.
There's nothing to distinguish nurses anymore at hospitals, except everyone wears scrubs. So the patients are like so confused. So like, we have no idea who's who. I would never want to wear a nurse's cap, but I think, I wish there was like some way to distinguish who was who. I get a lot of times, patients will explain, keep going on and on and on to me, and I'm like, can you go find my nurse? I am your nurse. Oh, you're my nurse. Oh, okay.
It seems to be the case that as nursing offers more economic rewards, that more men will be drawn into that profession. On the other hand, we might ask ourselves, why is it, given the advantages that now accrue to nurses, why it continues to be such a preponderantly female profession?
Men currently, with our economical status and the insecurity in a lot of jobs, what we're seeing in nursing is a big surge of people either choosing second careers. They may have worked in some other field that may have been eliminated, and nursing, there'll always be sick people. So with nursing, it's pretty much job stability.
Working class occupations that men could aspire to, that were good jobs, you know, working in the auto industry, for example. That's down the drain right now. Those were good jobs. They were well-paying jobs. So now I think we're in a historical moment where we're looking around and we are saying, what are the good jobs for men going to be? And then people look around and they say, nursing is a high-demand profession that we should be channeling men into.
We tend to be more handy. If there's something broken in the unit that we work in, we tend to fix it. If it's time for muscles to get a patient off the floor, we lift them. They use that expression, it's good to have a man around the house, but I don't think it was always that way.
There's a lot of different input that male nurses sometimes come across. Their thought process at times, they're able to sometimes understand patients in a little bit different way than a lot of female nurses. So I think the blend is very nice. I think we need to, for us to be able to change the image of nursing from being a female profession, that the more male nurses that we can actually get into the profession, I believe that media will change how we look at nursing. But I think that our salaries and possibly some of our other benefits will also improve.
I think if you had all male or all female nurses, you'd be missing out, because everyone brings something unique to the table personally, but also from their gender they bring something. Caring is traditionally considered a feminine trait. And I believe it is, because men have a feminine side. And I think through being a nurse, a lot of us men have surprised ourselves that we really care. It's really prepared me for other roles in my life, being a nurse. So I'm thankful to even be in this profession and to discover my feminine side.